Well, let's continue our serious business discussion this evening with our very serious and professional guests.
Very serious.
We have an expert panel tonight. I mean,
Experts of the
this
experts.
is probably 200 years of dentistry right here, don't you think?
Hey, watch it.
You're probably right.
Are you including us, Paula, or not?
Not.
We've got the amazing Dr. Andy Allgood, the amazing Dr. Barry Watson, and the amazing Dr. Kevin Devine. And so we thought we'd kick off tonight with just some clarification.
Hold on. Kevin, what's with the party hat? Why are you wearing a party hat?
I was just gonna say it looks like I've got a dunce hat on.
Too much fun.
Very serious introductions, yeah.
Love it. Love it. Oh my gosh. So we thought we'd start off with these guys who come to the retreats like every year, right, Eric? And they could give us a little bit of heads up on what we do. And so let's just put up the dates real quick and talk about this for a few minutes and get them to share their experience. That's the main thing. I want other doctors to know because they've been speakers and leaders, and I've been doing these retreats for a long, long time. In fact, Dr. Allgood is the one who really encouraged me. I don't know if you remember that, Dr. Allgood, several years ago to start doing these again.
I do remember that.
Yeah.
One of the few things I remember, Paula.
Yes. I mean, you've been a mentor to me, you know. So we have our team Zoom camp. We have our leadership Zoom camp. Now, this is going to be for doctors and office managers. We have our leadership retreat in person. So let's just kind of talk a little bit about what these are. Dr. Watson, you have attended the Zoom camps with your team and the live ones too. So anything you want to share about how that goes and what that looks like for you guys when you do the Zoom camps? And I mean, some of your hygienists have done the hygiene one, and we've just done several different kinds. Anything you want to say about what we do in these team retreats?
Well, I think that the most important thing is that every time we go back to the basics, and that's something that we get lost in the middle of doing everything, and it's just a great refresher for those that have been there before, and the new ones. It's a lot of it is new stuff that we haven't gone over. So yeah, I think we've always enjoyed it and had a real good learning experience. I was just looking at the leadership. I would highly recommend that for Dr. Dulcera and Laura, our office manager, because they're kind of each of them feeling their way along, you know, with the transition and everything. I think that would be a great thing for them. So I'm going to highly encourage that for sure.
That's a great idea for, I mean, we've got a lot of practices are transitioning. We have several that Eric and I coach that have done that in the last couple of years. And so you've got a relatively new doctor in the practice. He's not a new doctor necessarily, but he's new in the practice, new owner, working with an existing team member who's the office manager. Great time for them to get on the same page. I know they communicate a lot anyway. And then hear what other offices are going through. This has been a crazy couple of years.
Oh yeah.
You know, just insanity. So, Dr. Devine, tell us about the retreats in person. You've been to all of those. You've led masters. You've led breakout sessions. What do you get from those, or what do you see other doctors getting from those?
You know, it's kind of amazing because you go there and you think it's pretty much the same people, and it's just going to be a good time to get together and talk and kind of refresh our friendships. But you get so much more out of it. It's just it's hard to explain. It's one of the best experiences of the year for me. And in person, I've done the Zoom meetings and they've been great, but in person it's just different. You're there in the room and it's amazing. Things come out and you hear and you learn from each other, things we didn't know before. And I always go away with a smile on my face and smarter than when I came.
Yeah. Thank you for that. It's a real treat for me, and I'm so excited. I mean, Eric, we were going to do an in-person one right when COVID hit, and then so we haven't actually been together in the same room in a long time. so, so I'm really excited about that. And Dr. Allgood, what do you get from these type of retreats? You've been on some of the Zoom ones as a mentor. And sharing your experiences. What do you think about what we do and what we're teaching? Because all of you are masters at what we teach. So,
Well, I sort of look at these almost as going back to the basics that we did with dental boot camp.
yeah,
It's if the team is not with the doctor or the doctor is not with the team, then it's very difficult for either one to have the ownership of the principles, like the objection formula, or just building your practice. And so I think that's very, very critical. Obviously, you and Kevin were great with the mastermind group, the masters group part of boot camp. And I think that's sort of like the when the doctors get together in person. It's sort of like the masters boot camp.
yeah, it is. That's exactly right.
You work with each other with ideas and refreshing your brain, and it's like right now with my, I probably out of this group, I have less contact with the dental practices now than Dr. Watson or Dr. Devine. So it really helps me to refresh myself. And I'm actually going to start after the first of the year going to help with the dental school some. With the undergrads there.
That's so exciting.
That's awesome.
That's great.
And so I think this will sort of spruce up my mind, sort of re-enlighten me, and flock with some eagles. I think that's what really takes place, because today's generation of younger dentists, and I've seen this with the Dr. Lopez and others. They gain knowledge from each other.
Yeah.
The blogs that they get on.
Yes.
And I sort of equate that to the blind leading the blind sometimes. And instead of taking the experience of folks like Dr. Watson and Dr. Devine and you and Eric. And so I think these camps help along those lines. If you could draw more of the younger people in, the younger dentists in.
Yeah, they don't know what they don't know sometimes. And
I would on that. What don't you know? You can go through a pop quiz real quick and say, do you know what 95.5 rule is? Do you know what the reason for return ought to be? Do you know reservation versus an appointment conversation? Do you know the objection formula? Do you know how to do the case presentation formula? All of these things you can go through and just look at the skills and things that we teach. On the leadership side, do you know the 5 levels of leadership? If you don't know those things, then you got to say, all right, I'm missing somewhere. I'm not running on all cylinders for with my team or as a leader. And if you can look at those things and go, oh, I got that. I know that. Instead of, I think what a lot of people do is go, yeah, my practice is doing really well. But you don't know how well it could be doing if all the things were implemented. And I think that's where people miss out. Exactly what Andy's talking about. It's a bit like I'm blind, and what Paul said, I don't know what I don't know. It's missing.
Yeah.
it's not just looking at a number.
You make a good point, Eric, that I remember being in that position younger and saying, yeah, my practice is going well. Somebody asks, you're not going to say it's doing lousy.
Yeah.
And then you really don't know what well is. What's the definition of well? Because when you ask other people and they lie to you and tell you how they're producing twice what they're producing, you think, oh man, I'm doing awful, but I'm going to tell them I'm doing that. And you never learn anything. It's the one thing about these groups is, what we talk about stays there. There's no judgment. We've all been there. We've all had lousy practices. We've had good practices and done things wrong and done a few things right, maybe. And you just don't get that, I think, on these blogs from your peers.
That's a really good point.
Add to that, I think that having a safe environment like that is really critical, and you get to hear everyone else's stories, because all you know is what's going on in your office, and you get to share and to listen, and it's a real learning environment, and then you get to talk with people, off the cuff, and learn things too. So it's a good experience all the way around.
And get a little CE on the side.
A little bit,
Thanks to
now and then.
Ted Johnson and the Ipsos seminars. Let me ask you just a quick question. What's the difference in the types of meetings that we do compared to like local dental society meetings or things like that?
Oh, they're
My
not.
experience.
They're not even in the same. They're not in the same building.
No.
No, my experience has been the local dental society meetings are a place where you go and you complain. And
Exactly.
just talk about how awful things are. I remember when I was younger and eager, and I went to a meeting, and one of the senior dentists said, y'all would have been better doing what I should have done too and become a truck driver. This is an awful profession. And, that's what you hear at the dental society meetings. Or again, like I said before, you hear lies. So
yeah.
And ego. That's one
ego.
thing we really tried to create a culture, Eric. I think what we've done is this is not about a place to bring your ego and talk about how great you are and promote yourself. It's really about
Exactly.
learning, a learning environment, and supporting each other.
Well, and how many times a day on coaching calls do you hear this? Well, what are other doctors doing with X?
Yes.
I hear that over and over and over again. And I'm all about sharing that information. I mean, we just did one on iTero. I just did an blast email on implants, how to do implant surgeries. I mean, those are clinical things, which is great. You have room to talk about that kind of stuff. But and those are just two specifics, but I get that every day on what are they doing with hygiene openings? What are they doing with marketing? What are you doing? And it becomes non-clinical. And so this is a great place to say, what is everybody doing with X? I'm going to another mastermind this week. There'll be 10 doctors there. I'm excited because I'm going to go learn. It's not no pressure on me. They're going to teach each other. I'm just going to facilitate. It's going to be awesome. So if you're not doing a mastermind, a few times a year, you're probably you're not keeping up. You're not keeping up with what ought to be in place, especially when it comes to, both clinical, non-clinical. It's just, to me, the non-clinical allows the clinical to work. So, yeah.
For sure.
Yeah.
For sure. Well, this is a good conversation. Thanks, guys,
Yes.
for sharing your experience. And we certainly hope that more people will join in, because you become family. I mean, how many of y'all have become friends that you wouldn't have really become friends if you hadn't been to some of these meetings? And we've got some lifelong relationships that have been developed out of this. It's pretty cool.
True. Yeah.
Pretty cool.
Sure.
Yeah.
All right, Eric, what's next?
Well, been dealing with a lot of offices struggling, look at their tracker, and struggling with hygiene cancellations last minute a lot, and compounded with the April closure, then the October openings. We fought to fill the schedule and all that kind of. It's still showing up a bit where there's not as full of a hygiene schedule, but trying to figure out how to not rob Peter to pay Paul. Not making more openings somewhere else to fill in tomorrow, and yet I've got offices saying to me at the same time, I need to see more new patients, but I can't fit them in because my hygiene schedule is so far out, or my doctor's schedule is so far out. And then they're going, but I have these openings tomorrow. And so, I don't know, Kevin, did you use the exam typing system like Ted does?
No, we didn't. And, back when we had a discussion when Ted and Dave and I were doing masters, that all three of us did exams different.
Mm-hmm.
And it worked for each of us. So, and it depends on your situation, but it's really different nowadays here lately. I mean, we've, as some of you know, we've had some issues up here at Sorrento office, and down to one hygienist where we had two. And the one hygienist has been out this will be her 5th week out because she had surgery. And
that's tough.
So the hygienist we were going to hire didn't pass her boards. So we ended up these last 4 weeks, the doctors doing hygiene and doing a full schedule on their side. And well, not a full schedule because we had to cut back just to do the hygiene, but it's been crazy. And just like you said, today we had 2 cancellations in hygiene, which helped me because I was seeing both my patients and hygiene, but it doesn't help the schedule.
Practice. Yeah.
And our other problem is we've been so full, like you said, can't get new patients in. We've, I think block scheduling helps that a lot. And it's hard because you have this big opening and sometimes it's the last minute, you don't fill it, but you have to have a good short call list, and we've got that. It's, you know, we've had all these issues. Our hygiene coordinator has been looking a week ahead, that when our hygienist couldn't come back, she's supposed to come back this week, still isn't ready to come back. So there's 2 columns of hygiene that we have to take down to 1. So we got to move those people. So she moved a bunch of them today, and then that's for next Monday. Then the schedule of the people that she kept in there fell apart. She had called people back to try to get it. It's just, and we've never had that before. So it's a new world, and why people are not showing, I don't know, but I think the 2 things that have helped us the most probably are block scheduling for new patients, doing the intake exams separate from the cleanings if we have to, if we can get them in on the doctor's side first.
And that could be hygiene or doctor side. Yes.
Right. And that's, I mean, Ted was really good at that for years, where they would come in just through hygiene if they had to, and then they'd come back for the exam.
Yeah.
You just have to be creative. It's that kind of world.
And creative really is flexible. You know, Paul and I talk all the time about friction. We make it so hard sometimes for patients to do business with them. We all learn early on, make it easy for them to do what you want them to do, make it difficult for them to do the things you don't want them to do. And so if coming in as a new patient is important to you in your practice, then why are they waiting 4 weeks to come in? Because they're not, the no-show rate on that increases every week that you schedule them out. And you have an opening tomorrow for an hour in hygiene, you can't find a way to use that time to get that new patient in who just called you. And it has to be perfect. Like you're saying, it's gonna be a perfect storm. You call, move someone, and then something opens up. It's like, oh my gosh. So I get that. It's good. But if you have an opening tomorrow in hygiene and someone's on the phone with you wanting to get in, not for a cleaning, forget it's with the hygienist, just get them in and start doing the records part. Yeah. And then you can exam, type, and reappoint for the second visit and give you the right amount of time. Okay.
You're right. You can't have too strict of rules. You have to be flexible.
That's exactly right. Yeah. Yeah. Remove that perception that friction exists. Paula, I mean, what are you doing?
Yeah. What am I doing?
Yeah. What are you doing to help fill these hygiene openings and dealing with cancellations and try to prevent them, all that good stuff?
You know, Dr. Watson, were you going to say something? No. Okay.
No, I think you had frozen for a minute there.
Yeah. Okay.
Back. Yeah.
You know, one of the things that I like to share with teams is to get a call list going. And some people have a great call list like you guys do, Kevin. You've got a long one now because of all the things that have happened. But most practices, all they're doing is moving the canceled patients around. The patients cancel, they move them out because there's no room, and then they just move them back. And I just think that's teaching them that, you know, I use a word picture of like grounding your teenager, but then you let them off because there's a big dance on Friday. So,
yes.
So they're like, you know, oh yeah, she said I'm grounded for a month, but you know what? They're going to get me back in. So what I usually say is take your database. So if you have about 2,000 patients, the average practice has about 2,000 patients, I guess, 1,500 to 2,000. And you divide that by how many days you work, which is what, 190 or so a year? Is that right, Eric?
At least 180, yes.
Okay, so that's about 10 patients a day that you want to research. What, Dr. Allgood?
That's
you
too
never
much.
You never work that much. I know. Maybe that we should say the practice is open that many days. So that's, I mean, we're just doing ballpark numbers here, but that's about 10 patients a day that you want to research and find out, do they have a hygiene recare date? Do they even have a due date? Are they in your system? You'd be surprised how many patients are not even in your system.
Yeah, with Dentrix, you can have a patient in there and not have continuing care assigned to them. You can run that report and say, show me what that is.
You can.
And I think how you move the patient around, because these practices are doing, they're having to move patients. What you say is really important. I have a list. No, you don't have a list. Don't tell people you have a list, because then they think other people cancel so much that you have a list, and them canceling is no big deal to you. So, make it personal. Here's what I'm going to do, Ricky Bobby. I'm going to talk with Dr. Devine, and I'm going to see what we can do with his schedule and get back with you. And then when you do end up with an opening, you call him back and say, I talked with doctor. He said he'd be willing to see you if you were 100% certain it would work in your schedule. I literally was just working with a client, and we just started working together. They're in Utah, and they're having late patients, just this barrage of late patients. They're habitual. And, we're trying to figure out, well, did you run late historically? And that's taught them to be this way. But they're like, well, what do we do when the patient keeps showing up late and they expect to be seen?
Yeah.
And I just recorded a voice memo and sent it to them and said, how about this? But the point of the voice memo is, be honest with them. We're reserving an hour of our time just for you. When you show up late, either A, we've got to decrease the quality of service we're providing for you, which we don't want to do, or B, we've got to see the next patient late, which frustrates them. And we don't want to do that either. So how can we work together to create a win-win where we're both on the same page when it comes to your appointment start and stop times? That's just being honest and have a conversation and tell how you do things, instead of, oh, I'm going to teach them a lesson. Oh yeah, I'm going to teach them a lesson. You can't come here anymore. Or I'm going to charge you, or we're not going to see you, reschedule. And then they're late again. You got to have the conversation with them.
Yeah.
So same thing with cancellations. When people are canceling, just have an honest conversation about what it's doing to your practice, what it's doing for them not getting care, what it's doing for another patient not receiving care.
That's the apology, right? Did any of you use the apology with a patient? Did any of you ever have that happen where you had to use the apology statement?
Yeah, almost daily.
Yeah.
Almost daily?
Yeah, I have in the past.
You have? How did that go, Dr. Watson? Do you remember what you said? How did you
Well,
start?
yeah, it's just a good way of being honest,
Yeah.
I mean, if something's not getting through, you say, well, I apologize. I didn't explain that right, or something,
Mm-hmm.
and then you can have a conversation about it. Yeah, I've over through the years, I've just become much more casual in dealing with patients. I don't know if that's the right word or not, but just sitting down an eye level with them,
Being real,
not
genuine.
preaching.
Yeah.
Not preaching, working together on it. This is it's not just their problem, it's our problem. You do your part, I'll do my part.
Right. So
Are you seeing more cancellations post during this time than pre-COVID?
Yeah, especially in hygiene. Yeah.
A few.
Finding
Yeah.
it easier to cancel because they can blame it on COVID?
I don't feel good. I've got a fever. I got a sore throat. You don't want me in there.
Or even worse, it's not even them that's not feeling good. It's someone in their household now.
Oh yeah.
So that's what's expanded it. Yeah, it's been expanded. So they are in theory are in quarantine. This goes back to before we had a vaccine, before we were relying just on PPE, and we were saying, okay, and they're like, I'm not sure I feel safe coming to the dentist. Well, where are you safe? Where are you going right now? Oh, I go to Target, I go to Walmart, they go everywhere. Right. You go to church, but you don't come to the dentist. What are you afraid of, your own saliva? So this is about having that same sort of conversation on the phone with them. I've got to stay home, someone's sick. Okay, so are you in quarantine? Are you quarantining or are you just trying to protect us? What is it?
Or are you just using it as an excuse to not?
That's why you ask that question, because then they'll go, then you'll find out the answer, right?
That's probably right. Mm-hmm.
So sometimes in the old days we used to say, well, I'm sorry you're not feeling well. They would say, I don't know if you want to see me because I've been coughing, or I've got a stuffy nose or whatever. And we would say, well, we treat everyone as with precautionary measures. So we're happy to see you as long as you're not throwing up or running a high temperature or something like that. We don't say that anymore. We can't say that anymore. One thing you can do is go back to their condition and their dominant buying mark. Oh gosh, I'm so sorry. I mean, we definitely don't want you to come if you're sick, but I'm looking at your record, and last time you were here, this tooth is really cracked. Is it hurting you yet? That crack is probably going. You're not eating on that side, are you? I hope you're on like baby food diet right now until you can get in here. Cream spinach,
I'm still struggling with the fact that you said in the olden days when we used to say this.
In the olden days.
It's
Yeah.
called BC.
Well, Eric, I've always said I need Paula to come be my receptionist and all because
Yes.
and that's
Yes.
there's still an issue in that we're, as the doctors are sitting here talking about this, but these are things that really need to be covered in the Zoom meetings with the team, and I know you will be, because
Oh yeah.
I think it'd be a
Oh,
great
yeah.
thing to go around and have them participate in some role plays. Have
Oh
to.
yeah. Yeah.
Yeah, because
over to you.
sometimes,
Go ahead.
I was going to say, sometimes when it gets to us, it's too late.
Yeah.
It
for
should have
sure.
already been handled.
When you're
Yeah.
noticing. One thing that helps, and Eric, I want to play the apology statement with you, but one thing that really helps too, because the team gets tired of the negativity of cancellations, the doctor's upset, So start celebrating your 100% attendance days. Go through your tracker and look at the days where you had no cancellations, and let's ramp that up.
Find some positive.
I've had some doctors do
Yeah.
bonus on that. Have you ever done a bonus on that, Dr. Watson? Seems like you've done all kinds of bonuses. So
Yeah, I think we have. I'm not sure it's being done right now, but I'm going to bring that back as a reminder. Yeah. Okay.
it just puts a more positive spin, and what you focus on is what you get. So when you start focusing on 100% attendance days, you're gonna start creating more. But the apology goes like if it's a habitually late patient, like Eric, we had one who we would always just tell her 15 minutes before her real appointment time, and then one day she caught on. She said, "What time is my real appointment time?" And I'm like, "Oh man, she caught us."
Gotcha.
Yeah, with the text messaging, we have to actually schedule them at the
I
time,
know.
10 minutes before. And so we'll use that open column over there and put to schedule a patient 10 minutes before. Don't put an X or a slash in there. Create the provider color they're supposed to be with, but they're way over here, and then put a block in the actual provider schedule. Yeah.
So let's say Eric is my patient who's habitually late. So I'm going to have a conversation today. And this is knee to knee, Hargay, So Eric, I just, I'm glad you're here. I'm glad you're okay. I just wanted to let you know that we owe you an apology.
Oh, really?
Yeah, because obviously we've done something to cause you to continue to be late for your appointments. So what is it our team? What is it that we're doing that is not working for you?
Oh gosh, I feel bad now that you said that. I don't think you guys have done anything. I feel like it's just I didn't know.
Oh, okay. Because I mean, if we're running late all the time, and you're like, well, hey, I get there on time because they always see me 15 minutes late anyway. Then I want to know that, because we need to fix that.
No, I had no idea. I'm sorry too.
Okay. Oh, well, great. Okay, so that maybe we can turn this around, and next time be here on time so that we can take good care of you and get everything done that we need to do and not rush. Does that work for you?
That works for me, yes.
Awesome. Well, I'm excited. Well, let's get moving. So it kind of goes like that. I mean, those are better to do in person. That doesn't really work by text, and it doesn't work by phone. We want to do that knee to knee, eye to eye, right? With your goggles on and your face mask and your all that. So that's what we're talking about when we say the apology. It's not an admission that you've done something wrong. It's a conversation opener, right? Okay. So we got a lot of tools here in the toolbox. We'll have to remember all these when we do our Zoom camp. This is great for cancellations.
But I think I would love to hear from people what they want to work on, ahead of time. If your office you think other offices struggle too, you can, tell us what you want added into the Zoom camp and we'll cover it.
Yeah, we pretty customize it every time. Everyone is a little bit different in it.
That's right. That's right.
Those are the questions we get and things like that, for sure. Okay.
How hard is it to do role playing with a team on Zoom like this?
I think, that's a good question, Andy. And one thing that I really like when we do the Zoom camps is that everybody gets on. See, like how we are individually on the camera. And what works really well is if we can have everybody on with their face instead of a group. So some of the teams meet in the room as a group, but you can still get on. They can get on their device and show their face. Does that make sense? And then when we do the breakout sessions, we do the Zoom rooms, and that puts a smaller group together, and there's a little more safety, and they feel more comfortable doing that. But we've done it a lot, haven't we, Eric?
Yeah, I have a client. We just do 30-minute team meetings twice a month. That's how they like to do it. So today they texted me and said, hey, we want to do role playing with you. We want you to be the patient. They gave me 3 scenarios, and they were just one-on-one with me, and all 3 of them role played. And I was, it's better than what used to be on the phone,
Yeah.
So
it's much better than the phone.
Yeah, for team meetings. So, and then if they're in their room together, they can role play amongst themselves too.
And you can observe or give them different scenarios.
Yep.
That's awesome.
Yep.
Yeah, that works.
Yeah, Zoom has been great.
It really has to catch the body language that goes on. So
probably not as scary as getting up in front of the whole room, when
it's not.
When you're in your own space and you're just on a camera.
Yes.
They get embarrassed and they just turn their camera off. Right?
Or hide.
Where'd she go? She's we can't
just
call
fall
her.
in the ocean.
That's right. Yep.
Run over by a big boat.
Well, should we go? I want to get into a little bit of this time of year and the membership plans. Patients are getting their benefit packages for next year. And we're hearing some crazy things about dental plans for 2022. What are you hearing, Eric?
I just had someone tell me today, because they're in network and I'm helping them resign from networks as we coach through and grow. And they were told, I won't name the insurance company, that their fee is going to be reduced for a crown by $200.
Oh.
They're getting their fees reduced, not increased. So
Yeah.
And this here, let me there's some theory here. Okay. This is a conspiracy theory. This is just theory. As the workforce starts to decrease, I don't know if you guys are seeing this, but it's not just dentistry. Everyone's fighting for employees right now because people are like, I'm not going to go work for that. I'm not going to go do it. So now there's not that many people paying into the plan. And insurance works on the more people that pay to it, we can just pay the few who go, right? And when not that many people are paying to go, all of a sudden they go, oh, we don't have that cushion anymore. We need to lower what we pay out because they can't change the premiums.
Yeah.
They can't increase the premiums but they can decrease what they pay you. So the insurance company's never going to lose money on this deal. So instead of you, and I get offices telling me all the time, hey, how do I get a fee increase with my in-network PPO plan?
That's what I say.
That's what I'd say too. Yeah, it's like, is there a consulting company out there that I can pay that will go negotiate my fees? Yeah. And you're going to get 3% on a fee that's already an average of 35% lower than the going rate. What's 3% going to get you? And then you got to pay them again next year to do it. Why are you in network with them?
And you're paying this company $700 a month to do that.
That's right.
And then the fees go back down when you don't look.
That's right. And here's the thing. Why are you in network with MetLife, Cigna, Aetna? I don't know. when they're going to pay your UCR fee anyway. This company, this officer is looking at today. I mean, they only have 131 patients in Cigna, but their average write-off rate looks like it's about 25 to 30%, depending on, they're higher on their hygiene stuff, lower on their big things, right? I'm like, your profit margin is 25 to 30%. Okay. So 131 patients. So when you resigned from Cigna, and I asked him, I said, are you in network with other insurance? They just Delta. I said, okay, so with Aetna, MetLife, and all these other companies, do they pay your fee? Yeah. Then why are you in network with Cigna? Oh, it's scary though. We've been in network with them. That feeling. It's like, well, once you're at a network, they're going to pay your UCR fee.
Because somebody's grandmother has Cigna, and we've got to do it.
He goes, I looked at the list. I have a lot of friends on that list.
That happens a lot. I mean, I've got a doctor. We were looking at his too, and I was like, "Why are your adjustments like this?" And we looked at this one plan he's on. He's adjusting off 50% of his fee.
Oh.
We had another doctor this week that you and I both work with. 49%. One insurance company only pays 49% of his fee. I mean, what in the world? I mean, you can't keep doing that.
Why don't you just stay home?
Stay home. I mean, you're giving away. You're working 6 months for free, right, Kevin?
Yeah, be better off staying home.
So,
what amazes me is, like you're saying, we'll talk to people with about membership plans, and they'll say, "Oh, I really don't want to give somebody, give everybody a 5% discount," and it's like 5%, but you're writing off 29, 30, 40, 50%, but that's okay. It's crazy because they don't look. It's too scary to look at how much they're writing off. And
we have
pointing out their adjustments because they don't want to look at it.
We have two trackers, Kevin, that we use, and it's a population. Show me the population of each one of your plans that you're in compared to your active patient base, active because it's usually inflated, but they're equally inflated. It gives us a percentage. And then we say, all right, now put your fees in for that, your UCR, and it's a PPO write-off calculator that shows them what is their fee, how much they write off, and then what's the percentage of the practice that has that fee done. And it shows them just on 21 different codes, right? Your top 20 codes, what the annual fee is. It's crazy. It's crazy how much they're giving away. And it's eye-opening, and they have to look at it and go, okay, am I okay with writing this off?
And if they're adjusting off 50%, we're seeing that now. They're 50%. They're adjusting off. You could lose half of the people on that plan and still be okay.
And still be okay because the 50% who stay will be paying 50% more.
But you know what? Your lab is only charging you 50% now, right? And your supplies
and rent.
Your supplies by 50% too, didn't they?
Yeah.
Absolutely. Get a big discount.
I do lease negotiations, Kevin, and what I have the landlord do is every time we have a PPO patient come in, the rent for that hour goes down by 40%.
Perfect.
Yeah.
Brilliant.
It's in the contract. Yes.
Yeah, and if one cancels too.
It all works out.
Yes, if one cancels, they don't pay anything for that hour.
Yeah. I was just thinking, Paula, you remember how many months it took for our team to buy into the membership plan? They just couldn't see the big picture. They thought we were giving away the farm.
I know.
And they couldn't see the benefit. It took a long time.
It did. And now, I mean, Kevin, one of the practices you were in, they dropped the big D, and because of the membership plan, tell us what happened.
Well, because of the membership plan, a lot of things happened. Didn't lose very many, if any, of the patients.
You actually grew that year.
And actually grew, had higher treatment acceptance, better profits, of course, because we're not giving it all to Delta. And it was scary, but we went about it. They went about it in the right way, and it was barely noticeable. In fact, what we noticed was how much better things got. And it's funny because Maine, there's not a whole lot of dentists in Maine as a state, and so you stand out. And the president of Delta, Northeast Delta, actually personally called Dan to ask him why he dropped out. And then when Dan kind of told him the truth, he got kind of arrogant and mad and was acting like, you know, you're just going to die. You're going to this. You just ruined your whole practice. So I mean, that's how worried they are that people drop out of it because the president called. You know,
You can't live without us. I'm just telling you.
It's pretty
You know, that's what
crazy. And
they're.
that's, I think that's why the insurance companies are so good at hiding the fact that they're stealing your profits. That people think that it's okay to sign up with an insurance company, but membership plans, you know, we're open with how much we write off, and it's just out there and you see it. And it's, even though it's minuscule, teams don't think they write off anything to the insurance companies.
Yeah, they don't really get it, especially if they've got those insurance fees in their database. They don't even see their adjustments.
And I get it. It's scary to get out of it because the insurance companies have made you feel like you need them.
Yeah, exactly. So what do we do this time of year with our patients? What conversations are we having? We're having the use it, lose it, save it. So it used to be use it, lose it, but I had the save it on there because if you're in a membership plan, you're not losing anything, right? You're saving your money. You're actually saving more money than if you're on insurance because of the profit that the insurance company takes out of that cut. So you're cutting out that middleman of your benefit and you're getting all of your dollars that you get benefit for. Then we're also asking patients when they get their benefit package to call us before they sign up. Talk to us before you sign up for next year and let us go through that complimentary benefits analysis with you. I know some admin teams are like, oh, you don't have time to do that. And, you know, here's the thing. And Kevin, you can add to this if you want. How much time are you spending on insurance claims? And how much time would you save if you had people on a membership plan, you never had to file that claim? Isn't it worth helping that patient make a better decision for their dental dollars than working with an insurance company, right?
And it's not only the time spent on filing the claim, it's the time on the phone arguing with the insurance company why they haven't paid or how they lost your x-rays when they're digital and you send them with the claim form. And your time's much better, like you said, having that patient call and explaining the ins and outs of their new plan to them rather than sitting on the phone on hold with an insurance company.
Exactly. So that's what, and then DenVantage, we talk about DenVantage most every month, but it's such a wonderful program. And a lot of doctors are afraid of keeping those credit card numbers. And so DenVantage takes care of all that for you, right? They don't have to worry about the credit card number with the patient.
Right. Yeah. We're finding, that more and more people are getting into or realizing what membership plans are and starting to make a decision to do it. A lot of people, I think the largest number of people in membership plans are probably on do it their own plans. And they get turned off by it because they either write off too much or it's an administrative nightmare. So I believe that having someone do all that dirty work for you just makes sense. And of course, we think ours is the best, but I think any membership plan, any good membership plan is better than no membership plan and being in these PPOs.
That's right. That's good. Yeah. So, Eric, we've had more requests to get off insurance plans this year than I can ever remember.
I mean, I've helped offices resign from insurance for years now, starting with my father-in-law in 2000, with Delta. Yeah. And it's been ongoing forever, but never 10 at a time. I mean, it's crazy. It's crazy.
And some of the ones that we've helped, I mean, I followed up on one this week and they're like, yeah, it's not been a problem. The patients
It's been good.
Yeah, just they're getting it. I think they understand more than
we have a doctor that joins us almost every month and they're not here this time and they're in a Midwest state and they're so busy. It's so stressful. Like, this is going to solve so much of your stress problem because if some of them go away, it's usually the bottom 20 anyway, and that's okay. But B, if they stay, they'll be paying more and you can afford to hire more people to help you handle this. It's a bless your heart situation, Paula.
I looked at a tracker recently, and it's like, 45 patients and average of about $50 a patient
Oof.
for the day. I mean,
Yeah.
that's not sustainable.
If two things, one, you don't know what your production per hour, production per patient in hygiene is, that's a problem. Number two, if it's in the double digits, it's a really big problem. It ought to be at around 175 a patient and definitely north of 150 an hour per patient, or per hour 150 north, 175 per patient. You got to have that. If hopefully they're both at 175.
And that's a gross number, not an
Yes.
insurance fee schedule number. Right?
Yeah, that's your net production number. That's a real production number. That's what you want to collect too. And then you go, well, I can't keep good team members. They're going down the street for more money or whatever it is. And then you go, I can't raise my fees. Why? Because I work for the insurance company. Because my fees are dictated by them.
That's
It's this vicious circle.
It
and
is.
you gotta draw the line somewhere. And not everybody needs to be out of network. I get that. But if you're struggling with these things and you have a surplus problem, and it's just such an easier way to do this. And
Yeah, there really
happy to
is.
help. Yeah.
If you sit down and do the math, and just get the emotion out of it, the fear.
Yeah.
And that kind of what stops a lot of people. Is that what you think, Dr. Allgood, the fear?
The fear they're going to lose a patient or, over the insurance. And it's, I don't know. I found the best way for me to handle it was to never sign up for a plan.
Yeah.
You never, now in all the years in dentistry, 40 something years, you, Dr. Allgood, Dr. Watson, you as well. How many years in dentistry? I told you we had about 200 years of experience here, right?
46 myself.
46 years. Dr. Allgood, how many for you?
I was a little north of 46, but close.
And never on an insurance plan.
Well, I did when I first started out in private practice in that little small town in Georgia.
Right.
I did take Medicaid. All right. Mm-hmm. And it was almost a thing with demographics and different things like that. But I realized that was definitely not the way to go. Yep. And it's the Medicaid fees were still like the insurance fees. Now you just felt like situation. I was the only dentist in a small town.
Yeah.
And I almost felt like I had to take care of these little kids. And it's
yeah.
That's when I started a new practice too. So
but then since then, nothing, right?
Nothing. No, I never was on any.
Dr. Watson, same for you, right?
Yeah, same for me. Yeah, we did have early on in my practice. We had a Levi Strauss plant here. It was the biggest employer in the area, and they started a closed plan. And they came to my office and they said, well, you're going to have to sign up for this program because everybody works here, and you're just going to go out of business. And I told them, goodbye. I'm not doing it. And as it turned out, no one else in my area either. We didn't get together. We just all didn't want to do it. And so their employees had to go to Tennessee to get, and they got tired of that real quick and came back. And then the next year, Levi Strauss moved to Mexico, and I'm still there.
Yeah, there you go. Great story. Kevin, anything you want to add to that?
Well, just that Barry and Andy started practice, I think, before they invented insurance.
Oh.
You know what, Kevin, may I reply to that? When I first started in practice, it was 1974. And the first insurance plan that I saw was in the late 70s, like 78 or 79. And it was by a local textile mill. Then it was a freedom of choice. So you're right. There were not these insurance plans. There was no managed care. That supposedly what you call managed care. That really started about the time that I was president of the Dental Association back in 94, 95. And everybody was scared then that if you didn't join managed care, meant all these insurance plans, you couldn't make a profit. And that was even with the executive directors of these different societies throughout the country. And it was sort of scary. So when I was president-elect, I was the last speaker at a symposium in Washington, D.C., and I had a little bit to say about that. The Dental Association needed to teach us how to practice without being under managed care instead of how to practice under managed care. And it's a choice, and
You
people
remember early on when we started seeing the bad things about insurance as dentists, the few dentists got together and created their own plan, and that's what was Delta Dental.
Yeah.
It started
Yeah,
by
it started
dentists,
by
and
dentists. Yeah.
It was a
Yeah.
good thing out there, and then all of a sudden it wasn't run by dentists anymore, and it became this big monster.
And it's still considered a non-profit, believe it or not.
Yeah,
Yeah.
they're trying to fight them on that. That's going to change,
Yeah.
I think, eventually.
Yeah, I hope so. Well, guys,
The thing
this
a lot of people don't realize is that the benefits of dental insurance, in quotes, hasn't changed much over the years. I mean, when you talk about way back, Andy was talking about, the benefits were almost the same then as they are now,
oh yeah,
but the premiums have skyrocketed.
oh yeah, oh yeah.
Mhm.
They're going to pay. Most patients are going to pay twice what they get back in reimbursement
Yeah.
if you're a
Oh,
healthy
yeah.
patient. Yeah.
Oh yeah, yeah.
Well, guys, this
It's a
was
lose.
fun. This was great fun. Eric,
Mhm.
anything else?
Good.
I mean, we didn't get to
Objections?
wait till January. That's a big one, which I
Yeah.
would love to have that role play with these guys. We'll have to do that again next month. But
Yeah,
we're
absolutely.
changing the routine next month, right?
Yeah,
Eric,
yeah,
what's
we're
up?
gonna be on
Yeah,
the second
Wednesday.
Wednesday of the month. Yeah, we'll try something
Okay.
different. Maybe free up some schedules for
Okay.
people and try some. Hopefully, give people access if they're busy on Tuesday nights. So yeah,
Yeah, I've got one at fitness center tonight. Another one's in a sports match. Another one. So we'll shift the day around and have some fun with that. Just be flexible, right?
Yeah.
Second Wednesday. Mark your calendars. And we'll keep you posted on that too. So.
Awesome.
All righty.
Thanks.
All right,
This
you
is an awesome mastermind. Look at all the wisdom we
good.
got tonight. Isn't this awesome?
Yeah, I'm
So-
gonna tell Tushar to watch the recording.
Yeah, for
There's some
sure.
good tips. Good tips. Okay.
Good stuff. Really good stuff. Thank you
We'll-
all for
yeah, we'll get
being
it posted
here.
tomorrow. Yeah, thank you guys. Appreciate you.
All right.
Yeah. Okay.
All right, have a good evening.
All right. Good to see you all.
Take
All
care.
right. Yeah.
Take
Andy,
care,
Kevin,
everyone.
good to see